I always had an interest in nursing right from a very young age. When I had my second child, he became very unwell with pneumonia. I went to the GP. She assessed him for me and said, take him straight to the hospital. So I started feeling quite anxious. I had him in my arms and a nurse came into the room, didn't really introduce herself to me, started to assess my son, went to put the pulse oximeter onto his finger. He was 18 months. He got scared and he pulled his hand away, and she got quite stroppy at him and said, "Oh, stop that, you won't like it if I strap it to your toe," which just, my anxiety levels went through the roof. Told her to get away from me and my son. My son obviously got better with IV antibiotics. I got home and realised that if I could get into the nursing profession and attempt to be slightly better than that nurse was towards myself and my son, then hopefully I would make a difference in the nursing profession.
Growing up in very rural Queensland, my mum was the GP in the town, and she was always looking after people and seemed to know everybody, but always seemed to have something happening and seemed to get a lot out of what she did, but also wasn't just what she did either. So I kind of grew up in Westmead, so I was there since I was a resident, so I was the second year out of medical school, and so I'd been around that ward and all of those nurses for years off and on. I was looking after a middle-aged gentleman who had had quite a dealing with his family. We were actually discussing getting this gentleman home. He was unwell, but he wanted to go home and live out the rest of his days at home. We'd had this discussion and we were going to try the following day to get services in place to see if we could get him home. The family went home. A couple of hours later, he deteriorated considerably and there was nothing we could do to save this patient's life. So unfortunately, we had to call the family back in a couple of hours later to tell them that Dad and husband wouldn't be coming home. So on the day Suzanne was talking about, I was the surgical registrar who was on for the whole hospital on an after-hours shift, and there was an ALS call, so an emergency call to Suzanne's ward because her patient had suddenly become extremely unwell. And I just had this overwhelming feeling of emptiness, not knowing what to do, and I couldn't really concentrate on the rest of my shift. We had a lovely young doctor that had been up on the ward helping us earlier with this particular patient. It was quite confronting. I think I just noticed that Suzanne looked really upset and went to check on her because I thought, well, she looks like she's looking after this chap, and she told me that she'd been talking to the family that morning and it was obviously horrible, and so I just went and asked her how she was going. She obviously wasn't going well, and it's really confronting, and so I gave her a hug. I'm sorry, it'll be okay. So I think compassion can be shown in many different ways. I don't think it always has to be physical or verbal, but I think that to know that you're not alone in however you feel is really important. So to me, being able to show Suzanne that someone noticed what was happening and that someone cared made me feel not happy but glad to be there and to maybe make it not so horrible. I believe for me, being professional means to have compassion for each other.